Metachronous bilateral ovarian torsion. Metachronous bilateral ovarian torsion is a condition in which both ovaries undergo torsion, but at different times. This 35-year-old grandmother, then at 26 weeks of pregnancy, presented with a formal history of abdominal pain, swelling, and weight loss. Our initial impression after evaluation was actually a malignant ovarian lesion. So this was the ultrasound image at first presentation. This is the color flow, the lesion, and not this huge, well circumscribed lesion site. So the pregnancy was at 26 weeks. So we terminated the pregnancy and over time explored laboratory. So note the ascites here, note this heterogeneous lesion arising from the pelvis, note the cysts, which probably predisposed to torsion in this patient. Comparing the heterogeneity of the lesion to that of the liver. So this huge heterogeneous multilocular solids lesion. At least that was our diagnosis at the time for the ultrasound scan. 10 months later, again, he presented with abdominal mass and pain, but this time there was no history of weight loss. So again, this is ultrasound video, the Doppler, and this is the image after the second surgery. So let's look at the video. It's the vagina, cervix, uterus. So again, this is the lesion. Again, multilocular solids. Got this component was the solid. Here, multilocular solids. So here my working diagnosis was adrenal cell tumor, ruled out mucinous tumor. I also thought of the possibility of a metastasis from the initial lesion, because probably it was a malignant lesion that has undergone infarction as a result of torsion, and probably that was why there was no real histological diagnosis. This was my fear, but clinically the patient was apparently healthy, except for the mass and the pain. So here, comparing the ultrasound image in February and October, 8 months apart. So this lesion, February, and 8 months later, this was in the right ovary, and this in the left ovary. 8 months apart. Do they appear similar? Well, somewhat, but both are multilocular solids. But after surgery, this appears to be more of congestion than solid, but this is truly multilocular solid lesion. So, February, this was the lesion. October, this is the lesion. So while this appears fleshy, This is multilocular solid. Diagnosis: February, hemorrhagic infection. October, fibroid. So I'm making this not with learning points, but with some challenging points. Challenging points because this patient is 35 years old. She has bilateral ovarian. So there is loss of ovarian function. So what happens to her fertility? What about issues of prevention methods? Patient will require hormone replacement therapy for a while. We have considered oropexa during the initial surgery. Well, we couldn't have done that because we have not checked probably the intra-ovarian ligament to see whether it was really low or to fix the concomitant ovary. If there was a cyst, notice, would have followed up. That is how it's come and intervene the approval time. But all these are ifs. For now, the patient has lost her ovarian function, so they are reaching some facility. For time, she's a multipolar. All the children are alive. We should have to be on her own therapy some time. Thank you very much for this.